Hey guys, we're going to get started in a moment. Do me a favor and confirm you can hear me in the chat. Just do me a favor and confirm in the chat that you can hear me. And let me go ahead and share this live video. Somebody confirm that you can hear me, please. Oopsie, what's this? What did I just do? Okay, you can hear me. Okay, good. Thank you, Brittany. Hey guys, I'm going to get started in just one moment. Let me share this in the group just to make sure I let people know that I'm live. We're going to get right started right away. Oops. Let's discard that. Okay, guys. So good afternoon. We're going to go ahead and get started. So I'm going to be doing exam practice today. You guys have been asking when I'm going to do exam practice again. And I didn't think I would have enough time, but I said, let me just do it open-ended questions. So that's what we're going to do today, guys. So if this is your first time here, I'm going to explain to you how it goes. For those of you who have been here before and watched my videos before, you already know how it goes. We're going to go through some questions. I'll give you guys a few seconds to enter the answer into the chat, and then we're going to move on to the next question. Any questions that you have, save them till the end because I don't want to be a distraction for people that are watching a replay. So if you're listening to this and you're watching the replay, just put in the chat replay. For those of you guys that are watching live, I see you guys are already putting in the chat where you're watching from. So glad you guys are here. So let's go ahead and get started. I just wanted to make sure you guys can hear me. So this is good to know. Brittany did confirm she can hear me. Oh, hey, Mimi. She said, this is me, Mimi. Okay, Mimi, I would not have recognized that was you. Okay, let's see. So again, guys, if you have any questions, just save it to the end, okay? Because I'm not going to stop and answer any questions while we're going through this. I want to just get through it, and then we will answer questions at the end. So let's go ahead and get into it. So you guys know, I always start with some frequently asked questions. Will my old certification videos still help? Yes, they will, because as you will see, as we're going through this exam practice today, a lot of the information is still the same. It's just that some content has been added. So please don't think that any old material that you have, if you have the old study guide, if you have, you've been watching my old videos, please don't think that those do not apply because all of the information is still the same. It's just some added information, okay? The thing about healthcare, even if you're taking another certification, which that takes me to my next question, will your videos help if I'm taking a certification other than the CCMA? Yes, when it comes to healthcare, this foundational stuff is the same. Medical terminology does not change from one test to another. EKG placements, these things that we're going to be talking about, these definitions of some of these words, they don't change. So whether you're taking a CCMA, RMA, CMA, yes, these videos will help, okay? What do I do if I fail the test? Now you got to figure out which areas you fell short on and double down and study in those areas. Can I get a job if I'm not certified? Yeah, you can, but you don't want to. Okay, you want to get certified because you want to stand apart. And some jobs actually won't. Some will say no, you need to be certified, but then some will say, yeah, you can start out not certified, but then we need you to get certified within 90 days or maybe 60 days or 30 days. Okay. Can I give some study tips? Absolutely. You guys can take a screenshot of those study tips here. You can take a screenshot of this. I say these things all the time, so I'm not going to go through each one. If you notice, sometimes people comment on my channel or in the group and they ask for study tips. I usually just send them the videos because I repeat this stuff so much. I'm not going to stop here, but you guys can screenshot that. And one thing that I do ask is that you don't screenshot and distribute the slides that I have on here. Please do not screenshot my slides and send them out to anybody. If you need to screenshot something that you need to go back to later for yourself, that's fine, but please don't distribute anything that I've created. Okay, thank you guys. Let's get to it. All right, so providing instructions about effective hand washing is what type of coaching? Now, this question is an example of something that has been added. These are the type of questions that's added on the new content. So remember I said all of the information is the same, but some content has been added. So, and I'm doing it in an open-ended way because when you know it open-endedly, then you know it. That's like my number one tip is to make sure you can answer open-ended questions like this. So as you guys are typing the answers in the chat box, don't be, shy if you get the wrong answer. It's okay. This is what this is for. It is absolutely okay. So if you happen to type something and it's incorrect, you are not being graded. It is okay. So if you guys have the 3.0 version of the study material, then you guys know what the different types of coaching. So if you're providing instructions about effective hand washing with your patient, what type of coaching is that? Let's see if anybody is putting the answer in the chat. Okay, so I guess some people are probably stuck on this. I don't see many people, but that's okay. This is disease prevention coaching, okay? So on the 3.0 study material, they have added different types of coaching, okay? So when you are coaching someone on hand washing, that is an example of disease prevention because washing our hands is the number one way to prevent disease, okay? There's other types of coaching like treatment plan coaching when you're teaching people how to maybe check their blood glucose at home. And then you have health maintenance coaching. If you're providing information about like colon cancer screenings or mammograms, okay. And then the other type of coaching is patient. What's the other one? Oh, there's also what is the other one? I was about to say it's also which one is that one? When you're doing tobacco use, when you're going over tobacco use with a patient. That is patient educational material. Okay. Now, you may see those other questions on the test. So they may ask you about health maintenance coaching. Like I said, that's colon cancer screenings, mammogram, blood glucose, teaching them how to check their glucose. That's an example of coaching on treatment plans. And then, as we said here, hand washing is disease prevention coaching. Okay. Yep, disease. Okay, yep. See, you guys, a couple of guys did get this right. Okay. All right. Next question. Which medication route is given between the cheek and gums? You got to know those medication routes. Which medication route is given between the cheek and gums? Which one is that? Okay, I see some answers coming in. If you put buccal, you are correct. Buccal is between the cheek and gums. And then, of course, we have sublingual, which is under the tongue, right? And then you have oral, rectal, right? Okay, a provider fails to wash his or her hands before performing a procedure. Patient gets an infection. Which tort has the provider committed? Which tort? Now, while I'm waiting for you guys to type that answer in, let's talk about what a tort is, because you have to know that. You guys know that tort, that is a type of wrongdoing in which you cause a person injury, whether it's intentional or intentional. Your wrongdoing causes a person injury. Okay. So whether it's the provider or the medical assistant, if you cause a person injury, that is a tort. Okay. Whether intentional or unintentional. Okay, make sure you know that. Write that down because you got to know that as well. Okay, see answers coming in. That is correct. You guys put negligence. That is negligence. Okay. Making false statements about someone is which type of tort? So this is another type of tort. But this one you're making false statements. Which type of tort is that? You're making false statements about someone. Making false statements. Okay, I don't see any answers coming in yet. So I'll go to the answer. Slander. So when you are making false statements about someone, that tort is called slander. Okay. Defamation of character is a slander. Okay. All right. Which type of torts is when you are intentionally harming a patient's body? Which type of tort is that? Okay, Katie, thanks. Katie says I can hear you. Thank you, Katie. Which type of tort is that? When you are intentionally harming a patient's body? All right. This is going to be assault. So I hope you guys are adding these to your notes. Make sure if you don't have a notebook and pen out, make sure you have that out so you're making notes, okay? Because everything that I am going over, of course, it's this examination practice. So everything is going to, everything has a possibility of being in a question, okay? And again, the reason why I'm doing it this way is because, first of all, it was easier for me to go ahead and do the slides this way open-ended because it takes hours for me to create it when I'm doing multiple choice. And then two, this is a great way to test yourself because if you can answer questions in an open-ended way with someone just asking you, then you know it. And if you don't know it, then you need to be able to answer these type of questions, okay? So that way you know it. So far we've added assault, we've added slander, we've added negligence. Make sure you guys also know what battery is. Battery, many people get assault and battery, mixed up because a lot of times they're charged together, but battery is touching a person without their permission. So you may see a question on an exam that says, which of the following torts are you committing when you try to take a patient's vital signs without their permission? And that's battery. Okay. Assault is intentionally physically harming the patient. Now, is there anybody on here that's taking the CMAA? Comment that for me if you are. If you're taking the CMAA, the administrative test, because if you are, then your definition for assault is just a little bit different. Your definition is going to say threatening to touch someone. And so that's the only difference. Okay. All right. Which cleaning method destroys pathogenic microorganisms but does not destroy bacterial spores? Which cleaning method destroys pathogenic microorganisms but does not destroy bacterial spores? Okay, Rona says, yes, I'm taking notes. Okay, good. I'm glad you guys are taking notes. So please do. Okay, I see some answers coming in. All right, let's see. All right, so this is disinfection. Disinfection. So that is disinfection when you're killing some, and then you're also another definition may say killing some pathogenic organisms and rendering some inactive. That's another definition that you may see for disinfection. And then the definition that you just saw here was that it kills some, but not its spores. So spores are those reproductive cells, okay? And they're asexual. Those are cells that they don't even need another microorganism to reproduce, okay? So disinfection, it'll kill some, but it will not kill the spores. So in other words, the disinfection can continue to grow. Okay. Sanitation, someone put sanitation. Sanitation is simply reducing the number of microorganisms. So make sure you guys add that to your notes as well. Sanitation is reducing the number of microorganisms. And then, of course, you guys know we have sterilization, where that is killing or destroying all of the microorganisms. Okay. And you'll see, you may see any of those on the test as well. Okay, make sure you guys know the difference between sanitation, disinfection, and sterilization. And also make sure you know what type of instruments and equipment and supplies that you, not supplies, I'm sorry, but equipment or instruments that you have to disinfect, sanitize, and sterilize. Okay. All right, which veins are the most commonly used for venipuncture? Which veins are the most commonly used for venipuncture? So I'm seeing some answers coming in later. I'm thinking because some people are behind. That's the only thing, is that if you guys see some late answers coming in, I see some people put negligence, and we already talked about that and buccal. That's because that they are coming in later, so they're at different parts of the video. Just in case anybody was wondering why you see those late answers coming in. Okay, so I see answers. This is the median veins, okay? So the median veins, make sure you guys know the name of those veins as well, because you'll see questions about that. So when you guys go to check for your patient's vein, you always want to feel for the median vein first, okay? That's that vein right in the middle, okay? That's your median vein, and that is the vein that is most commonly used, okay? And that's going to take us to our next question. Which vein should be palpated next if the median vein cannot be felt? So once you feel that median vein, once you feel for that median vein and you don't feel anything, right? Which vein are you going to next palpate? Now I see a few people putting brachial. So remember, brachial refers to the artery, okay? So arteries, we don't draw from arteries. You guys are thinking about the brachial artery where we place the stethoscope when we're checking blood pressure. So just remember that, okay? Now when we're talking about the artery sites, we're talking about brachial, which is in the inner arm, right? And then we have radial near the our wrist on the side of the thumb, right? And then we have our carotid, which is on our neck, right? Those are artery sites, okay? We're talking about the veins right here. All right, so you felt the median vein, right? Nothing there. Next, we're going to go to the cephalic veins, okay? The cephalic veins, that is the veins that are like kind of on the outer arm. And then if you don't feel anything there, then you go on the inner arm, which is the basilic. And those of you that wrote brachial, I think you were thinking, some of you were probably thinking about basilic, because you were thinking B and you were probably thinking basilic. But that is the basilic vein that is in the inner arm. And those are like your last resort veins. So when you see the question, you may see it on a practice test, or you may see it on your actual test. It'll say something like, they may ask you the most common veins, right, which is cephalic, and they'll probably say, which is the last resort vein? And then you will know that it's the basilic vein, okay? That's that vein in the inner arm. Okay, so we got median in the middle. Cephalic is on toward the outer arm, and then the basilic is right there in the inner arm near your brachial artery. Okay. All right. What type of facility is a retirement facility for older adults? What type of facility is that? And I know you guys are probably, some of you guys, especially if you just joined, you probably wishing we had some multiple choice options. But this is the best way to test yourself, because one thing I do want you guys to do, especially for those of you that's looking for study tips, remember I tell you guys, get somebody to quiz you just like this, just like I'm asking you these questions. get somebody to just take your notebook and just have them ask you random things from your notes. Okay. Yep, Linda, you're correct. Assisted living. Yep, I see Allison. Yep, nursing home, assisted living. Yeah. So it's going to be assisted living facility. All right, next question. Which appointment method schedules several patients at the top of the hour and sees patients in the order that they arrive? So they're scheduling several patients at the top of the hour and they're seeing the patients in the order that they arrive. This is another big one, appointment types. And again, this is another one that is just the same across all of the certifications. So no matter which one you're taking, it's the same. Okay, I see some answers coming in. All right, so let's see. All right, for those of you that said wave scheduling, you are correct. Wave scheduling. So with wave scheduling, let's say several patients are scheduled at 9 o'clock. They'll sign in, but then they're going to be called in the order that they arrive. Okay. Another way the wave scheduling will be defined is that they'll say several patients are scheduled at the top of the hour, and then the rest of the hour is left open for phone calls or, for the provider to review lab results or something like that. Another way that they'll define it is how I wrote it, at the top of the hour, they're seeing it as they arrive. Now, the modification to that is when maybe instead of scheduling all 3 patients at 9 o'clock, they'll schedule maybe 2 patients at 9 o'clock. And then the next patient will be scheduled, that third patient will be scheduled at 9:15. If it's 15-minute appointments, or if it's 20-minute appointments, that next patient will be scheduled. 2 will be scheduled at 9 and the next one will be scheduled at 9:20. So make sure you guys know if this scheduling types is something that you struggle with, make sure you know the difference between wave, modified wave, right? And we have double booking where they're in the same slots, 2 patients in the exact same slot. It's not the same as wave, because if they're in the same slot and they don't have the rest of the hour open, that's not the same as wave. Okay. And then cluster, when all the appointment types are scheduled in the same blocks of time or on the same days, right? And now this type of scheduling allows a steady stream of patients all day long at regular specified intervals. So either every 15 minutes if they're coming in for a follow-up, or just a quick appointment, or maybe 30 minutes for a physical, maybe an hour if they're a new patient physical. But this allows a steady stream of patients all day long at regular specified intervals. Okay, just waiting to see if I see any answers coming in. Okay, so if you say stream or time specified scheduling, you are correct. In some instances, it may even be called fixed, but they are scheduled at regular intervals. So every 15 minutes, every 30 minutes, every, 45 minutes, or every hour, however your office sets it up. Physicals, like I said, maybe 30 minutes, maybe 45 minutes. That is stream or time specified. The patient gets the amount of time that they need for that appointment. Okay. All right. What part of the cell serves as the site of cellular respiration and produces energy? So this part of the cell, this is called the cell's power plant. The cell's power plant. What is this part of the cell called? Okay, I see some answers coming in. I see your answer, April. They are known as the cell's power plants. Okay, you are correct, April. And anybody else that said mitochondria, you are correct. So again, this is another thing you guys need to make sure you know parts of a cell. So as I'm going through these, guys, make sure you are also making notes of things that you need to make sure you know, right? So like I just said, appointment types, make a note of that. You need to make sure you know all of those. You need to make sure you know parts of the cell, you know, parts of the eye, parts of the ears, things like that. You know, anatomy is very important. Anatomy and physiology and terminology, you got to know those, okay? All right, what does the abbreviation NPO stand for? Another big one. Make sure you know abbreviations that's, you know, relating to prescriptions and things like that and orders. NPO. What does that stand for? What does that mean? Okay, see those answers coming in? Yep, if you put nothing by mouth, that is correct. Nothing by mouth is correct. Now, PO by itself is by mouth. NPO is nothing by mouth, okay? So if you have a patient who has an NPO order, that means that they can't even take their medications. They can't have anything. So make sure you know the difference between fasting and NPO, okay? You also have to know that fasting is when the patient can't have anything to eat or drink for a specified amount of time, maybe 8 hours, 12 hours, depending on what they're having done. But they can usually take their medications with maybe some water. Nothing by mouth means nothing at all, even medications. Okay. And what does the abbreviation QOD stands for? QOD, what does that stand for? QOD. QOD. All right. If you put every other day, that's correct. That is correct. A lot of people get that mixed up with 4 times a day. But remember, 4 times a day is QID. Okay. Every other day is QOD. Okay. Every other day is QOD. Every day is QD. Okay. 4 times a day is QID. 3 times a day is TID. 2 times a day is BID. And then every day is just QD. Okay. Now, what's QH? QH. What is QH? All right, see the answers coming in here. All right, if you put every hour, that is correct. Every hour. What is AC? AC. Still dealing with prescriptions. No problem, Allison. Glad you remembered. Okay, AC. Yep, if you put before meals or before eating, that is correct. AC is before meals. So as you guys can see, there are some prescription related and order related abbreviations that you do need to know. Which form allows the provider to bill the patient's insurance? Now we're about to talk about some administrative stuff. Which form is that? It allows the provider to bill the patient's insurance. What form is that? Another way that they may define this, they may say, which form does the patient sign to assign the benefits to the provider? This allows the provider to bill the patient's insurance directly. And again, another way they may define it is which form allows the patient to sign the form assigning his or her benefits to the provider. Assignment of benefits, AOB, make a note of that. And I just want to say something as I'm seeing some of these answers in here. I want to make sure you guys know what those are. So the CMS 1500. So guys, that's the claim form. So I can see why you guys might have put that, because you're thinking, okay, this allows us to get paid. But that form is actually, the claim form is, of course, what we fill out to send to the insurance to get paid. but the assignment of benefits is what the patient signs that allows the provider to bill the insurance, because without that assignment of benefits, the doctor cannot bill the insurance directly. The patient has to give permission, because if not, the provider has to, they would, the insurance is a third party payer, right? And to allow, so that third party payer has permission to send the money to the doctor, the patient has to authorize that. Like the doctor can't just go and say, oh, I'm going to, come bill you. The patient has to authorize that by assigning his or her benefits to the doctor. Okay, so that's the difference between the CMS claim form and the actual assignment of benefits that the patient signs. All right, what letter is sent to the patient to break down the status of a claim? So this goes to the patient from the insurance company after the patient has been seen, and it shows the patient the status. It shows whether the claim was approved, whether it was denied, what part of the claim was approved. If some of it was approved, meaning maybe the patient has to pay for some of it, the insurance paid for some, and I see the answers coming in. I see those answers coming in. All right, so I see you put EOB, Linda, and you are correct. Explanation of benefits. So the first one was assignment of benefits, AOB, where the patient assigns the benefits. Explanation of benefits is, and think about, it's kind of defining it. The name of it kind of defines it. Explanation of benefits. It explains the benefits to the patient. It explains what part of the benefits were paid to the provider, and maybe it'll tell the patient how much of the deductible was applied. Okay, but it goes directly to the patient. Okay. Yep. Explanation of benefits. Yep. Elizabeth, I'm sorry. Now, what letter is sent to the provider to break down the status? So this is a type of explanation of benefits, but this one is sent to the provider. So you guys have to make sure you know the difference between the one that's sent to the patient, which is the explanation of benefits, and the one that's sent to the provider. Okay, they both break down the status of the claim and show what was approved and denied, but one goes to the patient and one goes to the provider. Which one goes to the provider? Okay, let's go see. This is going to be the remittance advice. Make sure you write that down. The remittance advice is the explanation of benefits that goes to the provider. Okay, goes to the provider. All right, what type of coaching, another coaching question, involves instructing patients about procedure follow-up and home care? And I kind of hinted at this one earlier. I did mention this one earlier. So remember in the beginning when I mentioned the coaching, that is something that is on the test, the different types of coaching. I gave you guys several examples. So this one is about procedure follow-up and home care. Let's see. So this is coaching on treatment plans. So that one I mentioned earlier when I mentioned like glucose testing. So anytime you have to explain to the patient how to care for something at home, or how to, check their glucose at home, or check their, check something at home, or that maybe their INR at home, that's coaching on treatment plans. Okay. And I mentioned disease prevention earlier. And an example of that was coaching on washing your hands. Another type of coaching that I didn't mention was coaching on diagnostic tests. And that's coaching to prepare a patient for a diagnostic test for a procedure. Okay. And then one other coaching is coaching on community resources. Okay. And that's providing patients with resources that they need. Okay. Like meals or transportation. So you got to know what those different types of coaching. Okay. And you'll see it in the study guide. If you don't have the study guide, make sure you get that, the study guide and the practice test if you don't already have it for whatever test you're taking. Now, if you're on here and you're taking the CCMA, this is an example of something that's specific to the CCMA. Like I mentioned, all of my videos help with all of them, but this right here is specific to the CCMA. Now, I don't know if they have these coaching questions on the RMA or the CMA, but this is definitely specific for the CCMA. All right. Let's do some calculations. How many pounds is 20 kilograms? How many pounds is equal to 20 kilograms? Make sure you guys know the formulas. 20 kilograms is how many pounds? Once you know the formula, all you're doing is plugging in the numbers. Okay, I see you guys putting your answers in. If you put 44, you're correct. How do we come up with that? So we multiplied 20 by 2.2. So remember, guys, if you are going from kilograms to pounds, you have to multiply by 2.2. If you're going from pounds to kilograms, then you divide by 2.2, okay? So another thing to add to your notes. It's okay, Tori. It's all right. That's why you're here. That is perfectly okay. That is why you're here. So you can find out. So you will know going forward. That's all. And you just add that formula to your notes. When you're going from kilograms to pounds, you're going to multiply by 2.2. And then you're going to divide when you're going from vice versa, pounds to kilograms. And I will tell you guys this. I do have a video on my channel that breaks down all of the formulas you need from pounds to kilograms and height and weight, inches to feet and centimeters and all of that, and Celsius to Fahrenheit. I have that video on here. Okay. You do have to know those formulas for your certification exams, any of them. All right. Shortness of breath, dizziness, and throat tightening indicate that a patient may be experiencing what type of medical emergency? What medical emergency do you guys think of when you hear that a patient is having shortness of breath, dizziness, their throat is tightening or closing, right? That can indicate that a patient may be experiencing what? One thing they didn't mention that I didn't add on here was hives. I didn't mention hives, but hives is usually included in this too. A medical emergency. Okay, so I see a couple people put allergic reaction. Yes, specifically anaphylactic shock. Yep, which can be fatal. Okay, now make sure you guys can recognize these medical emergencies. So that was anaphylactic shock. Usually hives will be included in that one. And then make sure you guys know if the person is having chest pain and shortness of breath, you guys know that's usually associated with heart attack. And then when they are having involuntary spasms, right, that is seizure, and then fainting and lightheadedness, that's syncope, right? And then slurred speech, face and arms drooping, that's stroke. Okay, so make sure you guys know those. All right. What medical emergency occurs when the core body temperature drops below 35 degrees Celsius or 95 degrees Fahrenheit? So the body temperature is below normal. It is below 35 Celsius or 95 Fahrenheit. What medical emergency could that be? Body temperature is too low. Yep, I see the answers coming in. That is hypothermia. Hypo terminology, prefix, guys. Make sure you guys know them prefixes as well. Hypo means below or not enough, right? Deficient. So the opposite of that will be hyperthermia, when um, the body temperature is way too high. Medical term, specifically the suffix for pain. Okay, so one thing they'll do, they'll have you, they'll say which of the following is pain of the, a certain body part, and then this suffix will be there. Usually from the questions that I've seen, um usually it'll be kind of self-explanatory once you see this term, because I haven't seen any questions, and that's not to say that you won't see this, but I specifically haven't seen any questions where you'll see, and let me give you the answer first before I continue. It's algia. You guys got that correct. So usually I see it where they will only have one word that ends in algia, so you'll kind of know, because they'll be like, what is the what is the what is the term for a patient that's having muscle pain? It'll say maybe myalgia, and then some other terms, you only going to see one algia, so it's going to be kind of self-explanatory. That's kind of what I've seen so far, but that's not to say that it'll always be like that, because maybe they'll say myalgia, it's muscle, but then they may have other body parts with algia, and you got to know, okay, this one means muscle, maybe this one means what's something else, I can't even think of what else do we use. I can't think of anything. If I will, I'll come back to it. Let's keep it moving. When performing an EKG, which electrode is placed at the fifth intercostal space at the mid-clavicular line? Keywords in these EKG placement questions. Keywords. Fifth intercostal space at the mid-clavicular line. Now, those of you that have done EKGs, you've learned EKGs, you've done them. When you're doing when you're answering these questions, I just suggest you to really think about where you're placing your electrodes, and that'll help you, okay? Think about exactly where you're, like, actually picture yourself putting the electrode there, and then that's going to help you with some of these EKG placement questions. Okay. Yeah, fibromyalgia. Thank you, Shelly. Yep, that's a yeah, fibromyalgia. Yep, you might see that one. Okay, V4. Yep, so somebody put V4. V4, yeah. So V4 is at the mid-clavicular line, okay? So almost everybody that struggles with EKG placements always tell me they struggle with V4, V5, and V6. It never fails. It's always those three. When performing an EKG, which one is placed at the mid-axillary line? So we said V4 was at the mid-clavicular line. This one is at the mid-axillary line. Think about what are we referring to when we say axillary. This is, again, goes back to terminology, right? Goes back to knowing your anatomy, okay? Because what are we referring to when we're saying axillary? Give you guys a few seconds for this. Okay, I see the answers coming in. Yep, this is V6 because you're kind of under the arm, right? And then V5 is anterior axillary. Anterior means in front of or before, right? So if you're looking at anterior axillary in the question, then you know that's in front of the armpit before you get to it, right? So that's going to be V5, and then V6 is like under it. And so that's kind of the best way to kind of, for me, I think it's as simple as I can be. Like when you think about where you're putting it, mid-clavicular line, think about your clavicular line, your clavicle, that's your collarbone, right? Midway, you're placing V4, and then anterior axillary, which is horizontal to V4. So they may say horizontal to V4, and then they'll add that anterior axillary. Same for V6. V6 they may say horizontal to V5 at the mid-axillary line. Okay, and then of course you guys know V1 is at the right of the sternum, right at the fourth intercostal, and then V2 is at the left of the sternum, right? All right, guys, what's anemia? What is anemia? What is anemia? Okay. All right. So somebody did put lack of blood, specifically lack of red blood cells, because our red blood cells are responsible for our iron, right? And so once our red blood cells, we don't have enough, we subsequently don't have enough iron. So yes, I see some people have low putting low iron. Someone says I have it. So yes, lack of blood, specifically lack of red blood cells, which leads to low iron. Okay. A patient tells you that she has been overeating and then vomiting, and or she's forcing herself to have a bowel movement. What type of eating condition might she be suffering from? So she tells you she's been overeating and then she makes herself vomit or she makes herself have a bowel movement. What condition might she be suffering from? What eating condition or eating disorder? All righty. Yep, you guys put bulimia. Yep, it is bulimia. And then anorexia is the other eating disorder. In that case, they person has anorexia usually feel like they are overweight when they're not. They have their what do you call it? Body dysmorphia. Like basically, they feel like they are bigger than what they are. So that's anorexia. You may see that as well. So make sure you know that. And then binge eating, of course, you guys know what binging is when you're just constantly doing something. So binge eating is just constantly eating, overeating. Okay, so make sure you guys know those eating disorders. All right, what's the minimum temperature required for sterilization when you're using an autoclave? Minimum temperature required for sterilization when you're using an autoclave. This it should be at least how much? Okay, see those answers coming in. Yep, you guys got it. 250 degrees at least, or 121.1 Celsius. All right. Which hearing test involves instructing the patient to raise their hand when they no longer hear any sound? So you got a couple different hearing tests. You got the one, um, oh, you know what? I hold on, I made a mistake on this, guys. Hold on. Um, wait a minute. I think in the meantime, you guys can put the answer, but let me stop sharing my screen for 1 second because there's two different hearing tests and I need to change this because I put the wrong answer. Hold on, guys. In the meantime, go ahead and put your answer, but hold on 1 second because I need Sorry, sorry, guys. I was talking. I'm so sorry. I was talking. I'm sorry. Let me go back. So I was saying audiometry is, yeah, it's more specific than that. Sorry, guys. So the Renee test, I had Weber test on here. There's two types of Weber test. I'm sorry, two types of hearing test. You got the Renee test and the Weber test, and I mistakenly put Weber test. But with the Renee test, you will use a tuning fork and let the patient know when you no longer hear the sound. Okay. And I had Weber test on here, which Weber test is actually when you you have the patient to let you know if they hear it in one ear louder, or if they can't hear it in one ear, but they hear it in another. Okay. So you're testing the difference between two ears. And the Renee test, you're having them to let you know when they can no longer hear the sound. Okay. So you'll use a tuning fork. And you know what, actually, let me make a note to do a video on this so I can show you guys the difference. Because I don't have any videos of any hearing tests. So let me just make a note to show Renee test and the Weber test. So you use a tuning fork, and you will have the patient to, again, with the Renee test, like, you know, when they don't hear anything. With the Weber test, they let you know whether they hear more in one ear or the other. Okay. Sorry about that, guys. I'm so glad I looked at the chat and realized you guys and realized you guys couldn't hear me. I'm so sorry. All right. What are some examples of parenteral administration? So when we're talking about administering medications using the parenteral route, what are we talking about? You're welcome, Tanya. What are we talking about when we're talking about the parenteral route of administration? What are some examples? Even if you just write one, you don't have to write all of them. Even if you just write one example, so I can at least know that you guys know what they are. Okay, so I see you guys putting some examples there. Parenteral administration, not parental, but parenteral administration. All right, so you guys got it. Yep, subcutaneous or sub-Q, intramuscular, IM, intradermal, ID, and then intravenous, IV. Oh, no problem. No problem. You're good. Everything. All right, next question. What is the purpose of meaningful use? What in the world? And I should have capitalized that used. Sorry, guys. That use should have been capitalized. Let me fix that because I don't like funny about that. Hold on one second. Let me fix this. Fix my U. Oh no, I closed my slides. Sorry, guys. I'm just all over the place today. This is what happens when you're tired. I closed my slides. Oh, actually, at least this gives you time to gives you some guys time to explain what meaningful use is, because you got to type that out. Let me open my slides back up. I'm so mad I closed it. Oh no. Now I got to scroll all the way to that slide. This is what happens when you're a perfectionist. Even though I know you guys don't mind, I don't care. I have to operate in excellence at all times. So I got to make sure that's capitalized. So let me share my screen again. All right. Present mode. All right, share. All right, so that's better. That looks better, right? That's the correct way. Meaningful use. What is the purpose of that? Now, let me see if you guys are. Shelly said OCD. So, you know, let me tell you guys something about that. So, Shelly, you know what's funny is that, well, I wouldn't necessarily say it's funny, but I know a lot of people claim OCD, like when they like to clean up a lot, and, you know, where they just feel like, you know, they just like stuff in order. So you have people that are really OCD. And let me tell you guys, OCD is no joke, because when you are, when you have obsessive compulsive disorder, which is what OCD stands for, you obsess about everything. I mean, numbers, letters. You can't even drive without looking at the person's license plate in front of you and doing stuff with the numbers and letters. And you just can't even, you got to have things a certain way, and you got to do this and you got to do that. Like, it is it can be crippling sometimes, guys. And I see people when I see people that are very clean and they're like, man, I have OCD. I got to be clean. No, you're just clean. Now, there's one thing if you really are, if you really do have OCD and and part of it is your cleaning. But when I tell you guys, it is no joke. All right, so meaningful use. What is nobody wrote out meaningful use? Okay, let me make sure you guys know this, what meaningful use is. So meaningful use ensures that EHR systems are being used in ways that allow both quantity and quality to be measured. Let me explain that. So you guys probably learned this early on in medical assistant. That's probably why you forgot or didn't want to write it. Maybe you do know and just didn't feel like writing it out. But with meaningful use, what the Centers for Medicaid and Medicare did was they implemented meaningful use to make sure that providers are using EHR in meaningful ways. So this causes this, I don't want to say causes like it's a bad thing, but this requires providers to do certain things within the EHR system to make sure that they're using it to its fullest capacity. One of the examples I always give my students is that so when you have a patient, let's say you're working for a provider and they are mandated to participate in meaningful, they have to adhere to this, right? Because maybe they accept Medicare and Medicaid. I know back in the day, like if you accepted Medicare and Medicaid, you were required to, let's say if your patient tells you that they're a smoker, according to meaningful use, you had to make sure you ask them, how many years have you been smoking? And have you ever tried to quit? There's just extra things that you have to do within the EHR. You have to check off. Yeah, I asked them, how many years? Okay, did you ever try to quit? Have you thought about it? There's just extra things that you have to do in the EHR because it's available to you. The CMS, which is Centers for Medicare and Medicaid, they want to see that the provider is using the EHR to its fullest capacity. So that is meaningful use. Okay, guys. All right, let's go to the next question. Which laboratory department reviews blood cell counts, morphologic studies, and coagulation tests? Which laboratory department is that? So blood cell counts, morphologic studies, and coagulation tests. So that's going to the hematology department, okay? So that's going to the hematology department. Blood cell counts, you guys know that's drawn in the lavender tube, EDTA, right? Now, what was I about to say? Wow, there was something else I was about to say to that. I don't know. Hopefully it'll come back to me. Oh, you can hear now. Did I go out again, Tori? Did I go out again? All right, next question. Which laboratory department is responsible for blood typing? I see any coming in. Oh, I got you. Okay. All righty. I don't see anybody putting anything in here, and that's fine. That's the immunohematology department. Okay, make sure you make a note of that. Okay, make sure make a note of that blood typing. Okay, the immunohematology. Now, which laboratory department is responsible for studying very small infectious organisms like bacteria, fungi, and yeast? Which part of the laboratory which laboratory department is responsible for studying bacteria, fungi, and yeast? All right, let's see what we got coming up. Okay. That's microbiology, guys. So I see some people putting pathology. Pathology is looking for tissues or testing um tissue. So like pathology would be what's an example? Something that's going so like tissue samples will go to pathology. Hold on one second, guys. I'm getting a text on my phone I need to respond to. 1 second. Sorry about this. Let me show the next question so you guys can at least start responding to that one. What is the first step when assisting a patient who is bleeding profusely? And I'm here. I'm just trying to respond to something really quickly. Okay. All right. So you guys are correct that you want to apply pressure. That's the very first thing you do to the wound. But the way that they get you on a test is that they'll have put on gloves, they'll have apply pressure and all of that. But you want to put your gloves on first. Okay. So when you see that option, you'll see apply pressure as an option. You're going to see gloves as an option. But you want to put your gloves on first. That's how they get you, because you guys learned in CPR and first aid that you got to apply pressure, which is true. But the way they get you is by putting that. But then you got to make sure you put your gloves on first. Okay. Put your gloves on first. Okay, guys, I just want to remind you that on March 16th, I'm having a virtual study session for anybody that wants to join. It's at 11 o'clock Eastern Standard Time. So if you on the West Coast, that's 8 o'clock. If you are on Central Time, that is 10 o'clock. If you're on Mountain Time, that is 9 o'clock, okay? So you can just go to bookwithmissk.com. I hope that today was helpful for you guys. Don't forget, guys, if this video was helpful, if the study session was helpful, please like the video for me. If you are not subscribed, go ahead and do that. Make sure you join my medical assistant group as well. It's called the Medical Assistant Lounge, okay? And then also make sure you share this with your classmates and your colleagues. If you, again, like I said, on the 16th, I'm going to have the study session. It's a group study session, so it's going to be multiple people. It's $19.99. Or if you want to book a one-on-one session, you can go to bookwithmissk.com. So that group session is going to be 2 hours, and we just going to go over whatever you want to go over. Let me know if you guys have any questions before I get off here. Go ahead and put them in the chat. I'll wait a few moments. You're welcome, Linda. Let me know how you do, guys. Linda's taking her test tomorrow, so let's send Linda some prayers. Linda, we are praying for you that you pass your test tomorrow. Sending you good luck. You got this. I'm putting something in the chat right now. So make sure you guys, if you want to book anything, you're welcome, Esselina. Make sure you guys join my Facebook group if you haven't already. And I'm putting my link here too, if anybody wants to join that session on the 16th. You're welcome, Rona. Let me know if you guys have any questions. I'm going to wait about another minute or so and see. And if you guys don't, I'm going to get off here. I wanted to save the questions till the end because people would comment and tell me it was distracting going through all the people that's watching a replay. And I get it, because I would feel the same way if I was watching a replay of a video. You're welcome, Tori, as always. Will this stay on your page? Oh yeah, definitely. It's going to stay on my page. Yep, it's going to stay on here. Yep. I don't get rid of these. Let me know if you guys have any questions at all. We've been on here. Oh, we've been on here an hour and 5 minutes. Wow. I didn't think we were going to be on that long. You're welcome. You guys are all welcome. Brittany, T. Batty, you guys are welcome. I'm about to be on spring break, so I'm going to be working on this study guide next week. So today was my students' last day. They come back the Monday after next. What is that, the 11th or the 12th? So I will be on spring break all next week, and I will be working on this online study guide that I was supposed to be done with by January, but I didn't finish. So I'm going to be working on that next week, and I'll let you guys know when I finish that. It's going to be an online study guide. Oh, Katie's taking her test tomorrow too. Katie, you got this. Katie, let me know how you do. Which tests are you taking, Katie and Linda? Which certification exams are you guys taking? I just want to remind you guys again that the foundational information is the same. But there's some stuff that is specific to the only thing that I can say that was on this study session today that was only specific to the CCMA was the coaching part, because I don't have the RMA or CMA study material to say that that is on there. Everything else is just across the board for whatever certification you're taking. Okay, so Linda, you are taking a CCMA. Perfect. Which test are you taking, Katie? Oh, you're welcome, Angelus. I'm glad you were able to finally make it. For those of you that's joining for the first time live, I'm so glad y'all made it. Everybody, so many people always tell me that they wish they can make it live, and they're like, every time I miss it. So I'm glad that some of you guys were able to make it live for the first time. If this was your first time, you still here, this was your first time, let me know in the chat if this was your first time catching the study session live. Oh, same. Okay, CCMA. Okay, good. Yep. You just need that 390. Take your time. So Linda, Katie, when you go in there tomorrow and April, I see you scheduled on the 8th. Make sure you guys flag your difficult questions that you need to spend time on, right? Flag those questions and make sure you want to just use process of elimination as well. So anything that you recognize that is absolutely not the answer, make sure you eliminate those and then work your way to the right answer. But first, you're just going to fly through all the questions, all the easy stuff, and come back to those harder questions. Okay, don't spend too much time on the hard stuff because you don't want your time to run out. Those 3 hours, I'm telling you, it goes by so quickly, so fast. Allison, oh, this your first time. Okay, Allison T. Batty, first time. Valerie, first time. And April, I feel like I saw a lot of your answers in the chat, and I would say you were on point with a lot of your answers. I'm not worried. You got this. Rona, oh, same to you, Rona. You taking yours Monday, same thing. Make sure you flagging those wrong. I'm sorry, I said flagging the wrong answers. Make sure you flag the hard questions and then spend more time on those. Come back to them later. Get through all your easy stuff first and then come back. Use process of elimination because you're going to see some questions that you're going to be like, I don't know what in the world this is. And so it's just going to come down to eliminating what the answer is not. And the reason why you're going to be able to eliminate them because you know what those answers mean. And you're going to say, oh no, I know it's not this. I know it's not that. Then you may come down to B and D. And now you got to sometimes you got to just go from there. It happens. All right, guys, I want to end this. I'm just so afraid as soon as I end it, I'm going to see a question pop up. So if you're in the middle of typing a question, just copy it and then put it in the regular comments because I'm about to end it and I don't want it to pop up once I end it. Okay, so if you're in the middle of typing a question, please copy it and then just paste it in the regular comments because I don't want to miss it. Okay, you guys have a blessed day.